my revered brother-in-law as a slight introduction. So since we were Zocher to make Aliyah about 3 years ago, we've noticed very often that there is kids suffering from anxiety. The parents don't quite know how to deal with it. It is definitely an issue that we all need chizuk in. And really, I can think of no one better. I mean, he is my brother-in-law, I do have to say that. But that being said, I can think of no one better to address this topic. As the poster said, David and his family live in Boston. He's an assistant professor at Harvard. He runs a clinic which I'll let him speak about it more, that helps people with anxiety. So without further ado, my brother-in-law.
It's on. It's been on.
Great. Thanks very much for having me to your community. I'd like to thank my sister for arranging this talk, and thanks also for having her as your neighbor. She's not the easiest person to live with. Just kidding. She's wonderful and amazing. In terms of our agenda for today, and honestly, just thank you for taking my family in. They're amazing, and I'm so happy to be here to visit them and hang out with you for a little bit of time. So I thought I would speak for 45 minutes, as long as you put up with me for. And then time for Q&A. I imagine people have questions. And it's understood that if anybody's asking a question, then it's about somebody else. My hope is to just set the stage, provide some basic information about management of anxiety in families and what we can do about it. And does that sound like a decent plan? Great, because it is way too late to make any changes to my talk. So the focus, managing anxiety in children and in ourselves, I think it comes at a very appropriate time in history. We live in an age of anxiety. To provide some context, here's some data. I'm coming from the United States, where anxiety is worse, but according to the National Institute of Mental Health, that's the U.S. body that basically funds all reputable study, I shouldn't say that, but funds the vast majority of mental health research in the States, 19.1% of American adults, that's nearly 1 in 5, in every given year, have a full-blown anxiety disorder. Nearly 1 in 5 in every year. Over the life, 1 in 4 of those cases, nearly 1 in 4 of those cases, 22.8%, can be classified as severe. What that means is that 1 in 20 Americans every year has anxiety so high that they're actually incapacitated or potentially worse. Over the lifetime, that's every year. And then over the lifetime, it's 41.7% of Americans who have a diagnosable anxiety disorder. That's 2/5 of the population. Israelis fare far better. According to the Israeli Ministry of Health, which I was checking out on this trip, the yearly prevalence of anxiety and mood disorders among adults is 9.7%. It's about half. Yeah, it's still 1 in 10. And the lifetime prevalence is 17%, which is about 1 in 6. But that still means enormous number of Israelis are suffering. And unfortunately, children are at particular risk. In the United States, among primary school children, we're looking at between 5 and 10% have significant anxiety. It's about 1 in 10 to 20 kids. Among teens, though, it gets worse, and then the worst is the young adults. Teens, the Harvard Medical School's National Comorbidity Study, the NCS, 31.9% of adolescents in America, it's 1 in 3, has an anxiety disorder. So if you have a high school class of 30 kids, that's 10. And you know what the 10 do to the other 20, right? More specifically, it's higher for females than males. 2 in 5 females, and about 1 in 4 males. But it's still very high for both. I was unable to find any recent, in the past 10 or 15 years, data, published studies on anxiety among kids or adolescents in Israel. But I will tell you that almost all of my reputable colleagues in the entire country are full, especially those who are treating English speakers who come from the United States. Much bigger concern than prevalence, though, and everybody says prevalence, how many people are suffering? But the bigger issue we're seeing is severity. that a substantial volume of data says that anxiety isn't only common, it's very debilitating, and it's becoming increasingly problematic for the individuals who suffer. Last October, some colleagues of mine from the medical school published a landmark study among college students, and I mentioned college students before. They sampled 65,000 students in 108 campuses across the United States. And what they found was completely shocking, even to myself being in the field. They found this wasn't shocking, 1 in 4 students had reported being diagnosed with or treated for a mental health disorder in the past year. That's not shocking. But 1 in 5 students reported engaging in self-injury or non-suicidal self-injury, or NSSI. NSSI, for those of you who don't know, is non-culturally sanctioned destruction of bodily tissue in order to cope with emotional distress. I'm not talking about tattoos or piercings. I'm talking about people who are cutting, burning, or worse in order to cope with negative emotions. And that's 1 in 5 healthy, normal college students today. And it's even worse because about 9% of that population has had acknowledged that over their lifetimes they had tried to take their own lives. 9% of college students today in America. And that was before this whole crisis with the admissions thing from last year. So self-injury, I think, is less prevalent in Israel for a variety of cultural reasons and religious reasons and otherwise. But there are a number of high-profile studies showing that there are very few multicultural differences between different countries like the United States, Canada, Belgium, Denmark, China, Australia, and many more. Getting back to suicide, I don't know if you're aware of this, but in the United States, suicide is actually the second leading cause of death among individuals aged 10 to 24. The only higher one is, any guesses? Accidents. And a lot of accidents are suicides. But okay, let's not even get into that. More people die from suicide today than cancer, heart disease, stroke, AIDS, birth defects, pneumonia, influenza, and chronic lung disease combined every year. To quantify that more precisely, the CDC in 2017 reported that 17.2% of U.S. high school students seriously considered suicide. 7.4% of high school students had reported an attempt, and 2.4%, or about 1 in 40, were actually injured in an attempt such that they required medical attention. In the Harvard study I reported before, remember, it's 1 in 10, 9%, a little less than 1 in 10. Israel has higher or lower? Much lower. One of the lowest suicide rates in the world, interestingly. The global rate of suicide is about 10.6 per 100,000. In Israel, it's 8.2. So 20% reduction, just for living here. In the US, it's more, 13.1. Now, everyone asked me, what about religious factors? Yes, they're important. Regarding the Jewish world, so my colleague Tzvi Piratinsky from Touro College and I, we published more than 20 peer-reviewed scientific articles on mental health matters in the Jewish community, primarily in the United States and Canada. We found that Orthodox Jews, on the whole, tend to fare somewhat better than the general population in indices of mental health overall, which is good news for folks who live in OES. However, there is still substantial cause for concern. In a recent study that we did among 400 Jews in the United States and Canada, 21% were taking psychiatric medications versus about 30% of Orthodox Jews. Now, non-Orthodox Jews, so about 20%. Now, I don't know about any prevalent studies of anxiety or depression or mental health concerns among kids or teens in the Jewish community, but if I had to venture a guess, again, we're going to see a little bit less of an effect, but we're still going to see a lot. If you're looking at 1 in 5, if it's half of that much, 1 in 10 individuals in our communities who are suffering, then something has to be done. That's something that affects every person in this room and all of our families. The trends are shocking, are they not? What's even more shocking, though, is how bizarre they are. This makes no sense at all. We have fewer reasons to be anxious today in the West, definitely, than ever before in history. Globally speaking, especially in the States, we're wealthier, we're far more technologically advanced, we're more productive, more connected, and we're more comfortable than any human in the history of the world. Even here in Israel, where everyone's like looking at the United States, like everyone's paved with gold. But even here in Israel, are there any members of communities or institutions who don't have indoor plumbing or electricity? I mean, yes, there are definitely social issues and definitely financial issues, but most children have at least some access to basic medical care. Have you ever met a kid who didn't have the opportunity to get a flu vaccine? Whether you do it or not, whatever, I'm not getting into that. But that they actually were deprived of basic medicine. I'm not saying that there's nothing to be afraid of. In fact, in some ways there's more fear here, at least on the surface. But it seems odd that the most privileged generations, it's almost like the more privilege there is and the more wealth there is, the more anxiety and depression it gets. But it's even weirder, completely bizarre, is we have so many psychiatric medications today that they actually divide it up into categories. Like 6 massive categories of meds. Antidepressants, anxiolytics, antipsychotics, stimulants, mood stabilizers, that's just a few of them. And they're so widely utilized, 25% of the American population is taking some form of psychiatric medication today. And I'm not talking about fluoride, which is not a psychiatric medication, it appears in our water. I'm talking about Zoloft, Celexa, Prozac, Risperdal, Abilify. Abilify alone, this is my favorite, there are 20 million prescriptions for an antipsychotic drug, Abilify. There are 7.2 million children taking psychiatric medications. It's nearly 1 in 10 kids under 18. So here's another question. If so many people are taking medication to control their mood states, then why are we more anxious and debilitated by our anxiety than ever before? I'm not going to say measles, it's a bad example, but when's the last time you met somebody who died of polio? And if you did, they're probably 70 and it happened when they were, affected by polio. So it doesn't happen. So all of a sudden we have all these meds, and what's going on? So I want to address those questions, but I just want to define some terms first before we move. What's anxiety? How is anxiety different from fear? And what does it mean to have an anxiety disorder? So fear. What's fear? A natural and healthy reaction to a perceived threat. When you hear bomb sirens, then you're going to get activated and going to be nervous in order to mobilize yourselves. But it doesn't even have to be that. Whenever somebody's physical well-being seems to be compromised, there's this system in place called fight or flight. It summons our resources and optimizes our chances to move. And it's a good thing. It's a gift from God. The system starts with secretion of an adrenaline into the bloodstream. And that triggers a cascade of physiological changes throughout the body, which is really amazing. Increased circulation of oxygenated blood, increased oxygen intake, muscle tone increases, neural control of fast twitch muscles increases. The blood gets diverted from the extremities inside to vital organs. There's the digestive system tends to slow in order to divert energy to your muscles. It's pretty cool. The visual system augments such that you have dilation of the pupils to increase the field of vision. You don't need accurate vision. You need to just know that, oh, it's there, not there, and then to be able to move. In other words, when people get afraid, they become Superman, Superwoman. We become, these are healthy responses. And in fact, there's a test for something called the Moro reflex in babies that's tested for, that if somebody doesn't have an initial fight or flight test, an initial fight or flight response at the time of birth, that's actually an indication that there's something very wrong, and they usually call for a neurologist. In fact, if a child is born with no Moro reflex, they usually do it by picking up the baby a little bit and then letting them go onto the table, and they see if they startle. And if there's no startle after that, and after flicking, and after a couple other tests that they do that are done, invoking like a little bit of pain, then those children usually don't survive. So fear is actually a very good thing. It's necessary for survival, even if it's only once or twice a lifetime that you need it. But in contrast to fear, anxiety is the experience of a fear response with no fear present. So if you're having those adrenal gland fires and all those physiological changes without an actual threat, that is called anxiety. Interestingly, when people come to my office at the Center for Anxiety in New York, they often complain of physical symptoms of anxiety. They say they're having heart palpitations, they can't catch their breath, it's so hard, they're tense in their muscles, and they're having numbness in their extremities, like what's wrong with me, I can't even feel my fingers or my toes anymore. They're feeling a little bit dizzy because of their visual system, and it's all because of those physiological changes, which are actually very normal and healthy. People say that they're having stomach upset or digestive problems. That's because slowing of the digestive system, changing around the flow of blood throughout the body. none of the symptoms of anxiety or fear are dangerous. In the case of fear, though, they're good. In the case of anxiety, they're just not necessary. That's important. I never met somebody who died from anxiety. They might have died from their response to anxiety, but anxiety itself doesn't kill people. Interestingly, almost all people today have at least some level of anxiety, not only fear. Part of being a human being is that you're not perfect, and once in a while you might have a misfire, a false positive. And it doesn't mean something's broken, it just means it's an active system that works, thank God. But once in a while, we misperceive something, and there's really, there was nothing to be afraid about, silly me. But it's not, that in of itself is not a problem. But when it happens repeatedly and continually, it starts to create what we call significant distress or impairment, the DSM's famous language. And it's causing people problems in their lives, or making it very hard for them making it very distressing for them. And at that point, we say they have an anxiety disorder. It's arbitrary where that is. Every person is relative. Some people can tolerate more anxiety, some people can tolerate less. If it's significant in your life, subjective to you, that's something that is technically a disorder, which all it means is that you can get reimbursement for it from your insurance if you work in the United States. In Israel, it makes no difference. So I want to say something else here. Having an anxiety disorder, it's not like the measles or the mumps. There are no lab tests, there are no brain scans, you can't check a person's level of cortisol in their blood, not even for depression, for no mental disorder really do you find any laboratory tests, interestingly. There's nothing that can verify the presence or absence of an anxiety disorder. So, in fact, really all people lie on a spectrum, huge dimensional scale. Everybody in this room and everyone you've ever met is on that spectrum of anxiety. At some point along the way, we have our individual threshold that we might hit during the lifetime, at which point that's considered to be something which has to be dealt with. So it's less important whether people have an anxiety disorder or not, and more important about whether it's debilitating and whether it's causing distress and to what extent. Okay, so back to the question. Any questions? Anxiety? Actually, maybe I shouldn't take questions. That'll make me anxious. So let's get back to the question. Why are the most privileged people to ever walk planet Earth also the most anxious? So you might have your ideas about this. I'll tell you what I came up with. Maybe you'll tell me during Q&A something else. From my vantage point, the biggest factor is that Western culture today, which has seeped into Israel, especially here in your RBS bubble, is completely obsessed with control. We are control freaks. Even if you're not a control freak, we're control freaks. We're very risk averse, and we don't like to fail, and we don't like to experience setbacks. In the 1950s in the United States, 22% of the country was in dire, dire poverty. Today, the rate is less than 10%, and median income is more than it ever was. Yet people helicopter parent their kids, not just through grade school and adolescence, but into middle adulthood and often beyond, just to make sure that people don't experience failures. There's another factor which is related, which is uncertainty. Have you ever seen this device? So everybody has to be in the know all the time and continuously connected. I have minute-by-minute predictions in here for everything. Financial markets, politics, flu epidemics, professional sports outcomes, and I come from Boston, so that is a big deal. Weather, and despite the fact that those predictions are almost notoriously wrong, they're scrutinized like the word of Hashem and weighted with bated breath, sometimes by myself included. People pretend to predict the future and be dead wrong, then admit that they have absolutely no clue what's going to happen next. So we're very risk averse, overprotective, intolerance of uncertainty, and it all comes down to control. There's another factor, which is, I'm not going to speak about the education system, I don't want to get stoned. I have a flight to catch tomorrow night. I am going to speak about pain though. We're dead set on avoiding pain. My favorite stat here is that over-the-counter sales of Tylenol, Advil, aspirin, and other analgesics in the United States top $5.3 billion per year in the United States. That's more than the entire gross domestic product of the country of Fiji. That's more than everything Fiji ever produces every year. That's how much Tylenol and Advil that people take. Why are we so allergic to pain? Because pain and discomfort remind us that we are not in control. The reality is that life is full of pain and discomfort sometimes. People do get cuts and bruises and scrapes and sometimes worse, and it's not pleasant, and reality slaps people. And we're so used to it that people run from it. But we're used to running from pain. We can't tolerate that because every time it happens, it means I'm not in control. There's another factor, which is, and perhaps this is the biggest factor, is that because of that control freakingness and the allergies to pain, the insistence on being in the know all the time, people have an aversion to intense emotions, especially anxiety and sadness. The reality is that emotional fluctuations are completely normal. Have you ever had a bad day? Has anybody here ever had a bad day?
Sure.
Good. Has anybody here ever not had? Is there anybody here who's never had a bad day? Okay, I don't see too many hands. Really? No, that was just your scratching your nose. Okay. But in Western society, everything's got to be even keeled because that way you can control it. But if I'm having a fluctuation, especially if it's more than a day or 2 days or a week or 2 weeks or something serious, it's what's wrong with me? When our emotions wax intense, it reminds us that we're not in control. So we value avoidance of emotions and suppression of emotions as opposed to experiencing them to the fullest, the positive and the negative. When kids are upset, we always want to, right, lest they get hurt, quell them down, make sure they feel good about it, as opposed to life sucks sometimes. And if you learn one thing today, please let it be this, that distressing emotions do not kill people. It's our reactions to those emotions. I'm not saying that we shouldn't be compassionate when people are suffering. I am a mental health professional after all. But babying people and assuming that struggle indicates a lack of ability that oversensitizes us to failure, uncertainty, pain, anxiety, and depression. And that's why I think the medicalization of and making things into pathological mood states, as opposed to what's often normal, when our emotions aren't cooperating with our expectations, I'm not saying there isn't a place for medication, of course. I'll get back to this a little bit later. But we can't expect that we're going to be even keeled and in check all the time when we don't feel the way we expect to feel. That's not an illness. That might just be a normal fluctuation because, hey, we're not in control of how we feel either. The reality is that normal human beings have a range of emotions. Sometimes we're calm, sometimes we're fearful, sometimes we're happy, sometimes we're sad, and often none of it makes any sense because they're emotions. If you have emotions, it means one thing, that you're a human being. Now, okay, about meds. Yes, a lot of people do have intense and debilitating emotions, and when that happens, it is crucial to get help. I am not saying that any emotions, no matter what you have, it doesn't matter, you can wing it on your own. No, not necessarily. But we have unrealistic expectations about our emotions, and I think because of that, in other words, it's reasonable and good to have value, happiness, and equanimity, and of course psychiatric medication has a place, but this relentless cultural pursuit of happiness, it's just not helpful, not for us and not for our kids. Since ironically, the more we pursue happiness and avoid anxiety and pain, the harder it is to live in peace. There is a social aspect of this as well, which is worth talking about. I do some consultation for SAMHSA. It's the, what does it stand for? Substance Abuse and Mental Health Administration. It's like a government body that deals with substance use and anxiety and depression. So in the United States. So in Washington, D.C., when I consult for these guys, it's interesting, and ladies, they call mental disorders these days the no casserole disease. The no casserole disease. Any guesses why? When someone, God forbid, gets cancer or they have a surgery, what do your friends do? They bring you a lasagna. And what happens when you get depressed? Do I call? Do I not call? Should I say something? I don't know. Maybe I kind of feel a little uncomfortable. Is it really sick? I don't know. And the repercussions are just disastrous because people who are suffering feel that they're being distanced and judged by others. What I really think is going on is that people who aren't suffering at that time don't want to reach out because the fact that somebody else is having a mood fluctuation reminds them that they're not in control either. So there's almost this, cognitive dissonance of sorts. The reality is that all human beings have something to deal with today. Everybody has internal patterns of thought and behavior that needs to correct. I believe that Vilna Gaon said that's the purpose of life, so that means all of us have something to do. No one's born perfect, and that's life. And we expect others to be perfect or ourselves, or we might pretend to be perfect, which always works out great. That's a great ticket to my office, by the way, pretend to be perfect for 12 months. When we expect others or ourselves to be perfect, then emotional problems only continue to grow. People ask me about tech a lot. I'm going to blow through really quickly. I don't think it's because of technology that anxiety and depression are getting worse. I might be wrong, but I don't think it's because of technology. I think that technology is speeding up everything, including this message of this insidious, terrible message that you need to be even keeled all the time, into the mainstream. If we had potentially a positive message of acceptance and living with uncertainty and learning to embrace the fact that we're not in control, then in theory, technology could speed that message up and actually reverse its course pretty quickly. But that happens to not be the prevailing culture, and that's what the role is of technology. But primarily I see it, media, as being a mechanism, not a cause, if that makes sense. We can get back to that during Q&A. Okay, as parents, what do we do about the anxiety epidemic? And even here I think it's significant. Well, if being obsessed with control and certainty is the cause of anxiety, then the antidote is to let go, did you say? To let go. To accept that we're not in control and we can't know everything. That's easier to do when you're here in Israel, which I think is why your anxiety rates are much less. Because they're reminders, like we had on Friday or Thursday, wasn't it? So the number one piece of advice I can give is teach your children and yourselves that not being in control is part and parcel of being a human being. If we learn and teach that it's okay to fail, setbacks don't mean that we're not going to be successful in the end, and embracing that we're not going to know the future to looming questions, and that living with uncertainty or ambiguity won't kill us, that's the key. That is the key to dealing with anxiety. Here's a slightly harder one, which is to model that failure is a part of life. The successes that we've had are often in spite of repeated failures, or sometimes even because of those failures. To me, that's a very refining message. I talk, by the way, to completely secular audiences, just dropping the Hebrew idioms and phrases. It's kind of nice to be here and be able to show my true colors. But the idea here is if first don't succeed, trying again, because failure in of itself, or struggling, or not knowing, or not being in control does not mean that we won't prevail at the end of the day. Okay, I'm going to tell you how clinicians, like myself, educate our patients to give up control with a couple of cool cases. Teaching people to accept uncertainty, become more tolerant of pain when they have anxiety disorders. I don't expect that you would do this with yourselves, or with your children, or with your friends' children, or anybody else for that matter, but I want to give you a sense, just a little bit of a taste for how treatment looks like if you need it, or somebody in your family needs it, or you know somebody else who needs it. Clinically speaking, the main method that we use to treat people, which, by the way, Rachel Factor, who's here, can tell you all about, because we were schmoozing before our chat tonight, is that anxiety that we use for anxiety disorders is called exposure therapy. How many people here have heard of exposure therapy? Wow, I'm glad I'm here. That's about 10% of the audience. This involves helping people to face their fears head on and accept that they are not in control. Typically when people feel anxious, they fight off their distress by avoiding it. In behavioral terms, it's called negative reinforcement. We're moving away from something we don't like. But that only makes it worse, because by avoiding it, we're not realizing, we're actually failing to recognize that we are not in control and we can't deal with it. We can't face that uncertainty, which digs us deeper into a hole. I'm going to give you some clinical examples. Several years ago, a friend of mine, a rabbi friend actually, confided in me he had a fear of heights. And I encouraged him. I said, why don't you go up to the highest point you can possibly think of, somewhere with a view straight down hundreds of feet. I want you to peer over the edge, not on the other side of the rail, don't worry, on this side of the rail, and look over the edge until your anxiety naturally, it will go up, and then it will naturally come down. And it might take 2 minutes, 5 minutes, 10 minutes, probably not more than 15 or 20. but it will naturally ebb away on its own. I want you to peer over there. And he looked at me and he said, Doctor, you are crazy. What if I have a panic attack? What if I jump? I said, I don't think you're going to jump, and you might have a panic attack. He's like, you're bananas. Let go, let your anxiety wash over you, and just let it ride. A year later, I got an email from him stating that he had just come back from a trip to San Francisco. He had taken the opportunity to face his fears by traversing the entire Golden Gate Bridge on foot. He was looking over the side rail the entire time. He said he was shaking. He almost vomited several times. He did not think he was going to jump, but he was certainly thought he was going to pass out, and he just kept walking and walking. It took him about an hour or so. He said at the end he had this wonderful sense of calm because he wasn't on the bridge anymore. The wonderful sense of calm was because he knew that he had stood up to his fear, his anxiety in such a profound way, and he realized, like, I can tolerate uncertainty, I can not be in control, and I survived. And I was actually okay. I'll give you another more complicated case. A single frum female came to me in her late 20s, very significant OCD. She could not go to the supermarket. She had these unrelenting obsessions that she might have a brain aneurysm. And yes, she had been to a neurologist and she was completely clean. Of course, I'm going to check that before we do this treatment. She thought her brain would explode if she had high levels of anxiety, which, by the way, I've never seen, at least not yet. And we haven't lost a patient yet. And the last time she was in the supermarket, she had these very high levels of anxiety, and she thought her brain was going to pop off her head, and she thought she would have an aneurysm and die, which would be bad. And she's decided that she would never go back to the supermarket again. She could not tolerate that anxiety. She also had lots of compulsions related to washing her hands, where she would go to bed, when she would go to bed, religious rituals around that, and they were all aimed at protecting her physicality. Kissing mezuzahs, davening in a certain way. We mapped out her obsessions and her compulsions, and I found 70 different behaviors that she was engaging in on a weekly basis. She wasn't even the most severe case we've seen. She's probably in the mid-range. 70 different anxiety-related thoughts and behaviors that she was engaging in on a weekly basis. I said, the only way to get over this is that I'm going to push you harder than anybody ever has pushed you before. She's like, give it to me. I'm like, you are going to regret those words. She said, I want it. Okay. She was encouraged to face every one of her fears head on, with no medication, no relaxation techniques, and no avoidances whatsoever. She had these behaviors that whenever she would go somewhere, she would always have her phone with her. Because if she starts to die, then she's going to call somebody. So I sent her no phone, no ID, no wallet, into the supermarket. Maybe she'll die. And then we did it in times when her family was out of town. So then it would be like multiple days, and there would be all this confusion. And she had to face that fear, like, maybe I'll die, be buried in an unmarked grave, my parents will find out much later. I used to joke with her. I said, like, if you do die, then please tell somebody before you pass from this world that you have an appointment with me the next Wednesday, so that way I can cancel it and give it to the next patient, because it's really just not fair. So at a certain point, you got to see the humor in it, right? And she did laugh herself way through part of it, but not every session was very, very challenging for her. And she embraced the possibility of her imminent death every single day. The process took a year and a couple months, which is long, but she had a lot of symptoms. Today, honestly, OCD-free, really OCD-free. She is. She's a rock of a person. Thank God, happily married, a couple kids. She still struggles from time to time with worry, but it's not nearly debilitating. Okay, in other cases, when people have chronic worry, what do you think we encourage them to do? Worry more or less? Less?
Oh, you?
You think I should? Am I encouraging them to worry more or less?
More.
I'm going to encourage them to worry more. It's actually interesting. When people worry, what they're doing is they're actually keeping their anxiety at low levels in a chronic way. What I want them is to really worry about everything in a very specific way. That gets their anxiety to be very high in the short term. So often people say, like, what if, what if, what if? And it's very shallow. So I actually have them answer the question, like, what if? Like, what if? Like, really go there and actually answer the question, like, what if this were to happen, that were to happen? You lost your house, lost your job, or worse. And it's hard. It's really, really, it's scary for me to even think it. It's very scary. But that's part of life. And that's part of the process of letting go and not being in control and embracing uncertainty. Sometimes we help people to make recordings of their worst fears, and then they play them back over to themselves throughout the day. The mainstay of treatment, though, across the board is the more we feel out of control, the better. The more anxiety you're feeling, great. If you're distressed in my office, gold star for you. We want people to completely let go. For people who have panic disorder, so we have all these ways in my office of getting people to have vicious, wicked panic attacks. Oh yeah, constricting their breathing. We've never killed anyone, like I said. Making things really hot in the room to mimic those. We have the dizziness one's a little tricky. We have a strobe light. If they have epilepsy, of course, you can't do that. But we have strobe lights. We'll have them spin around in a chair, and then we'll put these strobe light on, turn on the heater, have them under a blanket, and then have them breathe through like a straw. That's actually a very advanced exposure to do all those at once. But we want people to completely lose control of their emotions in my office and learn to be okay with it, because they bounce back. When people have social anxiety,
Party time.
what was that?
Party time.
Party time with no alcohol. And by the way, alcohol is highly comorbid with social anxiety, particularly among college students, and you can figure out why. Social lubricant, and people feel all of a sudden that now you're right. What was it? Somebody said it was my liquor courage. I found my liquor courage. But that's not courage. So we have people ask, I have people in class ask a really dumb question. Because they're afraid of being embarrassed, right? So they go, teacher, what page are we on? Or whatever it is. And when people are concerned about upsetting other people, that they don't want to stoke other people's ire, we'll have them go to a Starbucks and pay in nickels for their drink during rush hour. Although in certain areas of New York, though, that actually is genuinely dangerous. In which case it's fear, not anxiety. So you do have to pick your branch well. But the bottom line in all these examples is that the message is the same. Giving up control, embracing the unknown, embracing that emotions will sometimes get the better of us, and that's okay. How does exposure therapy work with kids and teens? It's basically the same. There's only one difference, which is that we need parents, teachers, and mentors to be involved. Most of all, parents, teachers, and mentors need to let go and let their children experience high levels of anxiety and tension. It's not fun to watch your kid going through anxiety disorders treatment. They're screaming, they're a mess, they're upset, they're high tension. You don't know, oh no, what's going to happen to my kid? Maybe their head's going to explode. It's very hard to watch. So when we treat children, we instruct the parents not to accommodate their kids' anxieties. That doesn't mean that they can't buy them an ice cream afterwards. I'm not saying to be mean to your kids. Sorry for the sadists in the audience who want to do that. But I am, people should be generally supportive and kind. But if a kid's anxious about health issues, then don't take them to the doctor more than necessary. If anything, we're not going to do that. If kids have OCD and won't touch the door handle, then parents will often open the door handles for the kid. If they're excessively shy, not making excuses, sort of letting them deal with it. And often parents do need guidance in order to know where to draw the line. And if that's the case, then call in a consult. It's not a big deal. And don't worry about what the neighbors will say, because they're all in therapy too. And conversely, when kids who are anxious face their fears, make a big deal out of it. That's a reason for a party. That's definitely a reason for an ice cream. When kids are showing bravery and acceptance, and that they've moved forward, and that they cope with uncertainty, an anxious kid who forges ahead and accepts that they have a lack of control, that's gold. Those are your amazing teachable moments. And kids do that just naturally, so catching them when they're doing good. There's one more piece which is important with parents and kids. I can say this with confidence. My clinic in New York, the Center for Anxiety, which by the way you can check out on the web, www.centerforanxiety.org. We treat 500 new patients per year in our 3 clinics in the New York area. About 40 to 50% are from the frum community. I have never once seen an anxious kid who did not have at least one anxious parent. So often parents need to face and deal with their own anxiety when they're, at a minimum, tolerating the fact that the child is going through anxiety treatment. That is a factor, but typically it's something more. Just skip ahead and make some concluding comments. You know what, I want to speak about levels of care. Everybody's on a spectrum of anxiety, every single one of us. As long as you're a human being. Everyone here is a human being? Good. So, at low levels of anxiety, people don't need professional help. We encourage people to tend to sleep, diet, exercise. Just take care of yourself a little bit more. And that can sometimes do it. The next step up from that could be something like seeking social support. Talking to a friend, hey, I've been anxious lately. Talking to a parent, although that's typically a mentor, that's already another step. Speaking to friends, speaking to colleagues about it, people you know, people you don't know. Ideally people you do know. The next step from that is seeking mentorship. These are all things that, you know, I hope everybody's doing when we're coping with distress. The slightly higher levels of anxiety, something like pastoral counseling is good. Often, I don't know how it works here in RBS, but certainly in the United States, I encourage people to seek pastoral counseling from their rabbis or rebbitzins. But if people are spending more than 2 hours a month or 6 to 8 hours a year, then probably they need something greater. In those kinds of situations, there are self-help programs, which are books which outline these kinds of ideas as are specific to specific areas of anxiety. But if those strategies don't work, then it's time to consult with a mental health professional. And it's not a big deal. Like I said, the neighbors are also in treatment. So often it's enough to just get an evaluation and have ad hoc support once every 3 months, every once in a while. Therapy does not have to be every week forever or multiple times a week. It's not lying on the couch anymore. People are sitting face to face. You're speaking to somebody who's an expert like you would in any other field and saying, like you speak to your accountant, saying, hey, I have this tax problem or I have this question. How do I file this? Oh, blah, 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 blah. Great. Thank you very much. And that can often be what it is. Here's what I think the problem is. Here's what I think you should do. Would you like to follow up in 6 months or 3 months or a month? In certain cases, though, that's not going to cut it. People need weekly therapy, typically for a period of time. I recommend to people if they're not making headway in therapy over a period of months, not years, then that's a problem. In fact, in my office, we have a policy that if patients aren't making a move, are actually changing in a period of 4 weeks, then we change the therapist or we change the treatment plan 100% of the time. That's my specific clinic, that's what we do. In Israel, there are fewer options. I would give it probably 3 to 4 months minimum, given the climate here, but it shouldn't take longer than that to know. Beyond that, we might add a skills group, like a DBT, dialectical behavior therapy skills group. If people are more than that, we would look at an intensive outpatient program. I offer that in the United States. People come 2 to 3 hours a day, 3 days a week, 5 days a week for a period of 3 to 5 weeks. Intensive, concentrated treatment, focused on building skills, learning to accept uncertainty and other things, and then scaling down to weekly therapy with skills, and then hopefully moving down the course. And finally, there are hospitals, which in Israel in general I would tend to stay away from. But if you have to, then if a person's at imminent risk to themselves or other people, then that's what it is. All of those, everything on that spectrum that I talked about, from self-care all the way to hospitalization, everybody who you have ever met, everybody who ever will meet, and everybody in this room needs to take care of mental health, their own mental health, somewhere along those spectrum. I don't know if that's having a run or getting more sleep, or that means you need to go to Hadassah and Karen tonight. Somewhere on that spectrum, everybody lies. And the main question is, how much support do you need to accept uncertainty, give up control, and learn to accept how we feel, and to stay safe, I guess, at higher levels. I'll conclude by this. The tragedy of anxiety is how treatable it is. It's really about accepting uncertainty. But so many people don't get the help that they need. And the even greater tragedy is that anxiety tends to get worse over time when people ignore it and don't deal with it. I like to think about it as a mortgage, that you can pay it off. It's a massive sum, even if it's a big sum, you can pay it off over time. But if you stop making your payments, then you start getting angry phone calls. If I made one thing clear, it's that anxiety is virtually ubiquitous, and people who suffer are not alone. Not at all. Not at all. And given the current trends, there's a good chance that most, of us and our children are going to have to be, I'm not going to say you need professional help, have an anxiety disorder. Let's not be, alarmist about it, but I think we are going to, at some point during our lives and our children's lives, be more thoughtful and more strategic and more intentional about how we manage our emotions. And all that means is one thing, is that we're human. And should that happen, and when that happens, I hope and pray that we'll have the strength of character and the courage to accept the limits of our control, to embrace uncertainty over our own emotions, and to get the help that we need. Thank you very much.
You want to take questions and answers?
I can take whatever you want. You're welcome.
If anyone didn't give the 15 shekel donation, suggested donation, then there's a pishka here, so feel free to give it. Otherwise, I'm sure that some of you have questions, and he's more than willing to answer your questions.
Yeah.
Do you see, how does anxiety, it's not that the picture of anxiety that you painted for us is mostly for teenagers and older. Do you see anxiety in younger children as well? And how does that manifest?
Yeah. All human beings exist on a spectrum of anxiety. So you're going to see it in younger kids as well as older adults. In younger children, it's sometimes harder to pinpoint exactly what's going on. You might find them to be more irritable, more difficult, but through close observation, you can see that they're avoiding a certain person or avoiding doing a certain thing. Sometimes their kids are very idiosyncratic about certain behaviors that they'll engage in, like repeating things a certain number of times or avoiding a certain area on the couch ever since last Thursday when who knows what happened is going through their mind. If it's not causing significant distress to them or anybody else or impairment, we usually encourage watchful waiting, but if you are watchful waiting being just wait and see. But if you're concerned about something, then especially with young kids, it can be hard to pick up on, and it's good to get an evaluation. And I would also recommend specifically doing an evaluation with somebody who specializes in anxiety among children. In my own office, I would refer like a young child to only about 25% of the clinicians who work for me. And they all know their anxiety cold. But it's a sort of a specialty. Like pediatrics also, right? Any pediatric medicine. You're not going to, take your kid to an adult doctor. So it's very similar like that. Yeah, there was something here, yeah.
Is there anyone you recommend who practices with anxiety in Ramat Beit Shemesh the way that you do in your clinic and what?
That is a great question. I'd have to do some more research on it. You can get my email and you can email me. I will dig around and find you whatever you need. Yeah. Yeah.
I find here in Ramat Beit Shemesh and in Israel, there's a lot of expectations of our children here, and a lot of pressure on our children. And the system is causing our children a lot of anxiety and stress. They're having to live up to certain expectations or religious standards or call it a robot, whatever you want to call it, and they can't take the pressure anymore. And I wanted to ask you advice on how to deal with it.
Okay. I feel like turning off the recording, but I won't. I'm leaving tomorrow night. What's the worst that can happen? I'm going to say it like this. You can't blame the system here or in China or in the United States or in Australia or anywhere else in the world. All cultures have certain systems in place that either magnify or minimize this message of, be yourself and accept uncertainty, accept sort of who you are and who you need to be, versus people have to be a certain way, and it has to be, there are those pressures which exist everywhere across the board. Is it worse here than it is anywhere else? I don't know. I think one of the frustrating aspects about it in Israel for a lot of people is that it's tied up with the religious system. So people often are very frustrated for those sort of culture-specific aspects of it. But I'm not sure it's any fundamentally different than dealing with adversity in another area of the world. I think that's probably the most accurate answer that I can give you. That dealing with systems that expect us to have a certain standard or to act with equanimity when we're not is kind of part of the world that we live in today. That wasn't such a bad answer, actually. I'm not going to get started first here. There was another question at the back, yeah.
So in terms of, let's say, a child being exposed to an anxiety-provoking situation, whether
Right.
it's something out of your control or something like having your tonsils out. So I understand the exposure part, but in terms of a parent relating to a child and what a parent should say to the child to get the child through that, I'm not so clear specifically, like to say, to express that you're going to get through it and it's okay that things are not always in our control. Like how do we actually relate to our children when they're going through that? In addition to the actual exposure, okay, they have the exposure, but then what do we say to them to help them get through it successfully?
Okay, I'm going to clarify a couple things. One is that exposure is used when people are anxious about something. That's very different than like a traumatic experience that somebody has had. Okay, so what you're describing, I think, like getting your tonsils out or going through a difficult period of life or something like that, that's a life stressor which can bring out people's anxiety. Exposure is a tool to be able to remind ourselves, using a set of behaviors to remind ourselves we're not in control, we have to tolerate uncertainty, and life just is, we're human beings, and that's what life is about. When people are already faced with that reality because of either war or who knows what's going on, or getting their tonsils out, sometimes kind of have to go the other way and provide more comfort because they're tolerating the anxiety and giving with kids some form of reassurance, like things are going to be okay. Cousin so-and-so got their tonsils out, I got their tonsils out, it's going to work out, it's just a really difficult time. It's not a problem. I would probably be more inclined to take that approach when somebody's having a difficult time. Anxiety is more, remember, anxiety is a misfire when people don't have anything to be anxious about and they're having that anxious response. When people are having a difficult time, it's not really anxiety, that's more stress or fear. And that's the time for compassion. Yeah. Maybe one more question and then I think we'll adjourn.
What's the definition of anxiety? What about periodic, stomach knots, or what we call stomach knot, nervousness, stomach knots? Is that also part of anxiety, or?
Stomach knots can be a function of anxiety. It can also be a function of biological processes. But if somebody tends to get knots in their stomach when they feel tense, yeah, sure. I mean, I mentioned it before that when the adrenal glands fire, there's changes in the digestive system. There's a slowing of the system in order to divert energy towards muscles. And towards more vital organs away from the stomach. That can result in the discomfort that's described as stomach knots. And that can be a symptom of anxiety. Or it can occur because of stress or because of fear, and those are sort of different. So you want to know sort of, firstly, is it biologically caused? Is it, what's causing it? And then you can have a treatment that goes forward. Okay, I have one more comment, and then done more.
Yes.
One more. Okay, fine. I have time for one more.
Let's say for preteens, what is the difference between a tantrum and an anxiety attack?
A tantrum and an anxiety attack.
Do you understand the question?
Yeah, I do. Anxiety can be accompanied by anger and a lot of other emotions for kids and for adults, including depression, including anger, which I assume is what you mean by a tantrum.
Correct.
That is often a secondary response to the anxiety, or it could be a secondary response to not getting their way. I mean,
So how do you know that?
Okay, so either way, what you're dealing with there is, if it's an anxiety issue, you're dealing with a comorbid issue, two issues, which are simultaneously occurring. The tantrums would be a problem for dealing with the anxiety. So probably in such a case, we deal with the tantrums first, or at least concurrently. That becomes a clinical decision point and a bit more of a complicated one, but it's something that's fine. It's something that happens all the time. I mean, we deal with moody teens who are having panic attacks. That's like, bread and butter, and very normal and very common. And at a minimum, I can tell you that. Good. Okay. Thank you all very much.